400 prescribers under Medicare Part D were identified as having questionable opioid prescribing patterns in a recent Health Department Inspector General report. 5 of these prescribers work at Blue Ridge Pain Management in Virginia.
I find that somewhat frustrating. We're trying to minimize suffering and manage people's ability to function.
These 400 prescribers were said to have had either patients involved in doctor shopping or were prescribing extreme amounts of opioids, writing over 252,000 prescriptions and costing Medicare $66.5 million in 2016. But Dr. Baylor from Blue Ridge argues the report's results are flawed.
Using the terminology questionable is somewhat unfair. They're looking at a Medicare population. They're looking at an arbitrary dose number, and they're looking at patients who have been on those doses for greater than a year.
He also said multiple physicians at Blue Ridge will appear on their patients' prescriptions because they all see these patients, but that does not mean they're doctor shopping. 270 of the 400 prescribers' identification numbers were released by the Inspector General, and 1/3 did work for a clinic with multiple prescribers on the list. Blue Ridge doctors said they test a variety of methods to manage pain before turning to opioids, and when a patient does need the painkiller, they have a system in place to manage addiction risks.
We check the Virginia prescription monitoring program, and we make sure that we're the only people giving you that or medication, and then we know who else is giving you medication.
Dr. Baylor said they also use a program to monitor patients' prescriptions in other states, but not all states participate.
So somebody can cross into North Carolina and fill a prescription in the state of North Carolina, and unless we request the prescription monitoring program from North Carolina, we wouldn't know that.
Blue Ridge doctors also said they do urine and blood tests and regular and random pill counts. The Office of Inspector General said the list does not confirm that the prescribers were engaging in illegal or abusive practices, but they stand by the report's findings and thinks those identified warrant further scrutiny. But Dr. Baylor said they were never told they were on the list of questionable prescribers.
We're not drug dealers. We're physicians trying to take good care of people. We're trying to balance the risk of a dangerous medication like an opioid with the benefits of treating people who have severe pain to improve their lives.
And in the future, Dr. Dragovich hopes there will be more coordination between the government and physicians to help prevent addiction issues.
I want help from the people who have the data.